Hello, guys. Welcome to today's episode. I am your host, Anastasia Mula. And today we have a guest. We are going to discuss about pregnant women and the challenges that they go through when they are pregnant and when they give birth. And these challenges, they tend to cause postpartum depression most of the time. And we are going to learn more today because we have our guest today. And this guest is a specialist who will tell us more about postpartum depression and how you can know that you're suffering from postpartum depression. Welcome, our guest, and please introduce yourself.
Welcome viewers, I'm Simon Jenga. I've been working with one of the programs around Eastlands, and for the last 15 years, more than 15 years, we've been working with pregnant mothers mostly, and most of the time, today we let us discuss about the challenges they undergo through and the challenges they undergo through. Yeah.
Okay, so now, Semo, as we start, I can say you have experience with pregnant women. Not one, not two, but many of them. Maybe you can tell us, with these women, have you ever educated some women with postpartum depression?
Yeah, your question is right. Most of the times, because I work in a clinic, you get those mothers, they come to the facilities, and most of them, they come for assistance, not knowing maybe they are undergoing some stress or that depression. But through screening, you are able to tell this person, this mother might undergo postpartum depression. So that's where you start maybe by giving them counseling and support groups. And that's the reason I came to meet with you, Mother Street Smile, because you interact with so many mothers. And most of them, they don't know they are undergoing stress and how they can get how they can avoid to get into depression.
Okay.
So that's the reason we came, so that we can get hints and understand some few things on how to observe some few things, so that they can seek medical attention before they get into depression.
Okay, maybe you can tell us what are some of challenges that does a woman who is pregnant go through that can lead into postpartum depression?
There are so many things that make women go under depression. Most of them, sometimes we think the common word we use babies are breastfeeding, but not all mothers they get to be pregnant where they want. Maybe most of them amepata mimba labda hakuwa anatarajia huyu mtoto, and you find most of them labda alikuwa anatumia labda family planning akapata mimba, labda hakuwa amepanga at that time to get pregnant. So you might understand if somebody was not ready for that pregnancy, she will go a lot. She'll have a lot to cope with. And before she accepts herself, and that's the reason you find some of them, if they are not taken care of, well taken care of, along the way, these mothers they tend to be depressed.
Okay, so you're telling us it's possible for a mother when she is pregnant to have postpartum depression.
It's much possible because
Okay.
there are some triggers, there are some few things. Then when you're talking about postpartum depressions, when a woman gets pregnant, there are those hormones. So there are those hormones that may trigger to postpartum depression, especially in some trimesters, which we are going to discuss later. But now, and that's the reason I've told you, it's very important. And whenever a mother realizes they are pregnant, the first time they realize they are pregnant, maybe they have missed their periods, they need to go to the facility for support.
Okay. Yeah. So, will you tell us how common is postpartum depression and what are risk factors?
In our society today, people tend to think of depression or postpartum depression as if that this person is pretending. Whereas we don't screen it as a disease that needs to be taken care of. So most of the times a mother might undergo through the ANC clinic without, maybe if that profession, if she did not go to a professional clinic where they are going to get professional counseling or somebody who has that heart of helping those mothers, they might end up not getting the quality services. And with that, it means that mother might end up not be taken care of. and without taking good care of those mothers, they might end up to being depressed. And you see, in our society, we don't embrace more about counseling and dealing with mental health. There are rare cases you find somebody has gone to a facility, maybe for checkup of mental health, and you find they might try to heal on their own, which is more dangerous. So we encourage, it's good to get professional counseling, and professionals, they know how to guide. There are those at depression has different stages. There are those who undergo under medication. There are those who can heal through thoughts, through therapies, and all that.
Okay, now you have told us it's possible for a mother when she is pregnant to experience postpartum depression. Is there any self-practice, self-care that can help this mom to cope, not to get postpartum depression, or if she is going through postpartum depression, is there any practice, self-care that she can practice to cope with postpartum depression?
Okay, once a mother is being diagnosed with signs might lead to depression or postpartum depression, remember there are those medical attentions that are supposed to be taken care of, whereby you refer those mothers to counseling, to a counselor for counseling sessions. There are those who need maybe out of support group. When they unite together, different mothers, they share their stories, and you find that they start healing. And though sometimes it's not easy for them to heal, because there are those who are not talkative, they are not ready to open up to say what they are going through. But when they follow those counseling sessions and support groups, they now gain the courage to feel when they hear somebody else from somewhere, maybe they underwent through something that they are going through, they tend up to try to catch up and cope up with. Okay, maybe now you can tell us, now you have told us about pregnant women. Now, how soon after childbirth do postpartum depression occur, and how long does it last? There are different stages, as I said, about depression, and we classify them. We have postpartum depression, whereby a mother might go crazy after giving birth. There are those we call the other stages we call baby blues. Baby blues is whereby those baby blues, they only last like 2 to almost 1 week. But postpartum, mother might appear with those distress, and after recovering and not well taken care of through counseling session, if you are not able to detect that this mother had postpartum depression, and they go now home, and everybody, as I said earlier, in our society we don't accommodate, we have not appreciated the fact that the counseling sessions are very important in our society. Or somebody going for any medical checkup for cancer, for psychological test. So when a mother goes home and he has never been attended to she has never attended to any counseling session, they tend to just forget about what happened. But these are cases that they keep on recurring. So research shows that a mother it can take even to 3 years, up to 3 years. And that's the reason you find a mother has completely disconnected with the baby, which is not common. Sometimes you say, hapo ni kujifanya anajifanya, kwa nini anatukia mtoto, and get all that. And sometimes we forget in our society, maybe this mother is undergoing something. Let me give you a practical example. Think of that mother who has gone to a facility. Maybe she was ready for that pregnancy, but only to find that she is HIV positive. You can imagine the kind of stress that mother will undergo. Think of now, and that's the reason we appreciate working with other organizations like Mothers Real Smile, because when you get mothers, you can refer them appropriate. Think of that mother who can get initially what I want to bring up is we need to seek professional counseling. Because like if you don't get a professional counseling, I was giving a practical example. This mother who appears in a facility, she has been tested, she is pregnant, and now she ended up discuss. Ladies to talk. And at times they go and discuss with their fellow friends. I tell them, okay, I tested positive. I have a kid here. So if she learns somebody who has no information on how to take care of that kid, they give simple solutions. You need to do like abortion because if you keep on this, you keep how can you cope with a positive kid? Not forgetting that if that mother ended up to a professional counselor, she could be guided on how to take care of that kid and be assured that maybe even if you are positive, it's not automatically that you're going to get a positive kid. Through support groups, like where I work with, I have seen so many mothers come for support groups, and they do share. And for instance, I had one client. She was she could not understand how a positive mother could give a positive, a negative child. And by the way, it took some few months, and when she decided now to come to the facility, and she got no support, she was like, so it happens. So, but you see, where she was getting information from, it was not a professional information she was gathering from the community. But because she was being given fake information, that is not a fact. So that's the reason we are saying mothers might think, I was saying, somebody who is positive and thinking of now she has a baby. Maybe she was longing to have a kid and now she's pregnant and HIV positive. This mother that thing can cause that mother to get into depression. So without professionals counseling, you see, they might install that mother maybe into being crazy. Okay, so the more you have told us, postpartum depression can make a mom not to bond with the kid. It can also lead to other side effects. Now tell us, if postpartum depression is not treated, maybe it has faded out after a while. It's not treated. I just ignore it. And now I give birth to another kid. Can I have postpartum depression after giving birth to another kid because of the past history? Past history is very important, and that's the reason we say anything that occurs in your body or any medical change in your body needs to be attended and treated the right way. Okay, I like the way now you are coming up with this program of postpartum, or dealing with postpartum depression or stresses that mothers that are going through while they are pregnant, because this is something that can reoccur. Okay. And it doesn't mean because once you got first kid, the second one, and you never underwent through those depression and all that, it means that with your giving birth to the fourth kid, that you're not going to get depression. So it can occur anytime, in a pregnancy. It doesn't mean that because you have never undergone depression to never come. Actually, I've asked that question because I have a friend of mine. She has 3 kids. She never went through postpartum depression with first, second, and the third kid. It was bad. She even forgot her number. She even forgot herself. And she could not recognize herself anymore. It was very bad. But thank God she got the right treatment that she needed. Now you can tell us, is there any treatment for postpartum depression, and how can someone now help for kids, for example? Here it is postpartum depression. How is that postpartum depression going to affect my partner, maybe my husband, or my kids? Okay, when you're talking about postpartum depression, remember when somebody is pregnant, this is a new kid you're bringing there, especially in that nuclear family. And how prepared are they to welcome that kid? Okay. It might not affect you as a mother, but might affect your spouse. Okay. Let's think of the current situation about the economy. Let me cut you short. Now you are telling me it's possible for fathers to also go through postpartum depression. Yeah. Wow, that's interesting. It can affect the fathers. Have you ever heard stories of whereby mama? Okay, the last born, mostly it happens with the last born, sir. The last born that one hataki kuona mtoto kabisa. Yeah. And sometimes we assume ametaka anamtupa because anaona kama ana repress, not forgetting that this kid have their own reasons. Yeah. We have had maybe at the mothers, they talk of mi siwezi nikaacha mzee wangu venye anagogaga huyo mtoto. Like I had a friend of mine who was sharing and she told me alikuwa ametoka nje and when she was coming back alipata mtoto wake anachapwa na a month old. Alikuwa anachapwa na baba yake and she was like, kwani mtoto amekukosea nini? To me, I could not take that as if it was normal, because in a normal situation you cannot find out somebody who is mature trying to punish a man's kid or weeks. So maybe that person was undergoing something that was maybe kwa nini anaona huyu mtoto ameniletea stress kwa nyumba, huyu mtoto ameleta another cause. Hata wengine wako like kanaweza mchapa akufe, it's okay. And they are even comfortable with that. So it's something that, and I like the way you approach, because now when we are talking about preparation of giving birth and how to take care of that kid, sometimes we forget about the entire family. How prepared are they to welcome this newborn? So it can affect the entire family, but mostly sometimes we focus so much on the mothers, and we have, as I said earlier, and that's the reason, even in, let me take you back, even in clinics, men are also encouraged to support their wives when they are attending clinics. Yeah, sure. The reason behind that is because maybe one of the criteria one of the strategies that are used when they get to those clinics, those mothers, they are taken look at sessions. So that's where they can express their feeling. How ready are they? Because most of them, after getting pregnant, not like Kikabo, mama ndio wanaenda hospitali peke yao. Yeah. So we can then, you as a man now, you can express to the counselor and tell them, me, I was not ready. How can you support us on how maybe we can do this and this and this? Sometimes they ask for abortions, and now you guide them the right way. Yeah. And you refer them appropriately, because at that point you are able to detect maybe this man is undergoing some stress. So it's something that can affect the whole family. Okay. Yeah. Maybe you can tell us, if I suspect I'm suffering from or I'm experiencing postpartum depression, what should I do? Sometimes you see with depression or stress, it's very hard for somebody to know I'm stressed. Okay. But there are those indicators that you can get to know that, okay, I'm not the right way. I'm not in my normal senses. For instance, there are those who, when they are stressed, they oversleep. Okay. There are those who are, when they are stressed, they overeat and they start gaining weight. There are those who, when they are stressed, they don't sleep at all. Yeah. You get, and so there are different people behave differently. Okay. So when you find you are not behaving the normal way to be, let it click in your mind. Something is happening. Something wrong is happening in your body, and the best thing you need to do, you need to go for. Like the way somebody can detect after on a homa and you go to a clinic and now get some dawas to help you. Yeah. So the same case we should, when we realize our body is not behaving the way it's supposed to be, we need to go to clinic, because in that hospital, even if I'm not feeling bad, missing mojo, but I'm feeling my body is not the way it's supposed to be, it's not acting the way it's supposed to be, I need to go to seek for professional treatment. Yeah. Okay, that's why I do say every time, it's good if you feel like you're experiencing postpartum depression, you visit our sites, you follow us on all social medias, Mothers Real Smile, just inbox us, or you can just text, I need help, and then we'll know how to reach you. And when we reach you, we'll help you and we'll advise you accordingly. Okay, doctor, maybe as we wind up, you can tell our audience something about postpartum depression, or something that you feel has been affecting community. And first of all, let us know, in your facility, do you talk about postpartum depression when moms comes for antenatal clinics? Are moms around your area aware, or is not something that is being talked in facilities? As I said earlier, it depends on the facilities that the mothers are approaching when they are pregnant. But what I'm sure of, in our facilities, we do those sessions. Okay. And what we do, the first thing most is to screen what they are going through. Yeah. So when you screen that mom, and you realize maybe she's undergoing something, you can refer them.
Thank you, Simon, for being here today. We appreciate your presence here. We appreciate you coming here today because I trust people have known more about postpartum depression. And if they suspect something to do with postpartum depression or any sign, they will seek for the right help and they will be helped on time. And as I do say, when the mother is happy, the whole community is happy. Thank you for watching today's episode, and don't forget to subscribe to our YouTube channel. You can follow us on our social media account, that is Mothers Real Smile on Facebook, Mothers Real Smile on Twitter, Mothers Real Smile on Instagram, and Gmail is mothersrealsmile.com. Thank you guys and be blessed.